I'm so grateful that the three of you guys agreed to share with our listeners why, as a health professional, you've chosen NeoLife when you could have chosen anything, any products. And so we're going to start with John. Your father last night did a great job of speaking, but it's exciting to see two generations of health professionals that are having an incredible impact. So John, tell everybody where you're from, if you would, how many years with NeoLife, and then how has NeoLife impacted, actually, why did you choose NeoLife?
Okay. So my name is Dr. John Hickey.
Mr. There.
My name is Dr. John Hickey, and I am from Boise, Idaho. So there's a few reasons why I chose NeoLife is the patient stories. So I actually got my dad onto the products, and he started using those with his patients probably 7 or 8 years ago. And so seeing all those testimonies and stories, that's why I incorporate it in my practice now. Another thing is the products and the product line is so simple. So the breakfast pack is what we recommend to all of our patients. And the breakfast pack is designed to fill the gaps in your diet. And so many patients are missing all these core nutrients. So using the breakfast pack is so simple, especially as a healthcare provider. And there's a lot of other companies out there that you have to go to weekend-long retreats just to understand these protocols and these herbals and all these different things. So NeoLife has made it so simple, and I'm sure you guys would agree on that. So extremely simple. And then a couple things that I've noticed, which is awesome for healthcare providers in general, is the lasting effect of the income. So for example, my dad's retired from chiropractic, but he is still making an income from his nutritional sales with his patients from NeoLife. And then another thing that's really helpful for myself is I've got fantastic staff. I pay them well, but I can't pay them well enough. So what I do is I utilize NeoLife so they can get a bonus for some of their efforts with that as well. So I love NeoLife for a lot of different reasons. And if you're listening online, or if you're here today and you're a healthcare practitioner, it is such an amazing company to partner with, and I'm excited for the rest of my career with NeoLife.
That's awesome. And let me ask you this, as a healthcare practitioner, owning your own practice, how many hours do you work a day, generally speaking? What's the max that you could work in your practice that would be reasonable for a chiropractor?
I would say probably maybe 6 to 8 hours a day.
6 to 8 hours a day.
Treating patients, yeah.
Okay, so maybe 5 days a week?
Yep.
Okay, so you're a top, well-respected chiropractor. I've heard some of your patients talk about you, had the privilege of coming around and actually visiting you guys. So I know you have a heart to help a lot of people, but do you feel like you're limited by the number of people that you can see each week? And how has NeoLife expanded your impact?
Yes, so that's one of the things. It's like I understand like how many people I can actually treat in a week, but with NeoLife, it's opened up the door to help so many more people even across the world. I've got different people in my team who've reached out to other people across the world to be able to help them, and it's amazing how it can expand and how I can help so many people with health and nutrition outside of my office. And that's one of the amazing things. That's really where my passion lies. I love what I do as a chiropractor, but I'm very passionate about nutrition and helping people with their health. So that's one of my favorite things about it.
Love it. Thank you so much, Dr. Hickey. All right, and Barbara, will you share with everybody your profession?
I'm a registered nurse, specialty in gerontology, care of the elderly.
And the director of nursing.
The director of nursing. Oh, that's important.
Yes. And Barbara, will you share with us, why did you choose NeoLife?
Well, it's interesting. NeoLife came to me. I had no health issues. I was just tired. So when Dean Vandenberg, who is here, thank you again, shared NeoLife, I was really excited about cellular nutrition. Again, I was just tired, but all nurses are tired. Everybody in healthcare profession is tired. So I tried it, and I had so much energy in 2 weeks. I don't know what kind of energy, but I was just on going. So I really didn't have any challenges as far as health. But the product works. Something went on, so I shared with others, and they got the same results.
That's awesome. And how has, answering the same question that I asked him, would you touch on that? How has your impact as a health professional been expanded through this model? And is it possible for health professionals alone to tackle the challenge that we're dealing with today with chronic sickness?
No, it's really challenging. And with the chronic issues that we have globally and in my profession, I see so many conditions that I am very helpless. I wish I could give every individual's patients as well as employees the NeoLife, but because of regulations, you can't. So I am swimming in a pool of chronic conditions that more and more it's becoming saddening to my heart. So I really believe in the future, probably pretty sooner than I think, I may have to step out of that arena so I can minimize individuals who have gone into the C section to get them back to the B or the A to wellness. It's very challenging to do it while you are in there because your vision is just so narrow. But if I step out, and I'm stepping out more, I am more effective and building a better team and better people around me for support.
That's awesome. Well, Barbara, it's amazing what you're doing, even part-time, the impact that you're having across the country and in other countries. So
yes,
congratulations,
absolutely.
Barbara.
Thank you.
And Dr. Amanda Smith, you certainly see a lot of products where you practice as a pharmacist. Can you answer that question as well? And maybe even describe what you see on the counters. I mean, you a sea of products. Why has NeoLife attracted your attention?
Well, Josh, I have to say when we first introduced NeoLife, it was the incredible stories of health transformations and the community that totally got us to begin with. But I have to admit there was an aspect that seemed a little too good to be true, and the science in me had to do some further research. What I see on a daily basis is a highly unregulated industry of supplements. I see needs not being met nutritionally, but I see everybody trying to fill those needs with a different product in a million different companies. And so when I started digging, I was amazed by the sound science and the scientific advisory board. The further I dug, the more I saw integrity. Integrity that was unparalleled in this industry. And I saw a company that was committed to quality, not to market. And so that was very important to me. I saw the quality of the products and that the products definitely worked, but also I saw a company that was committed to doing the right thing all the time. And that was super important to me. And so the values of the company, the quality of the products, all of that just really did it for me.
And as a final question for you, as a pharmacist working in a large chain of stores, have you seen, we're talking about the increased awareness here in the last, over the last year of the importance of nutrition. How have you seen that with your own eyes? Is there, of course, you just heard from these professionals that these products are second to none, but are you seeing an awareness and an interest in nutritional products?
Definitely.
More so?
I think with the pandemic, I have to tell you, we worked from day one, and probably, I would say, 6 to 8 months, our shelves were empty in front of our counters, and that's where the supplements were, because everybody was frantically trying to get their hands on vitamin C and zinc and all the supplements that were being recommended to help boost immunity. And so I definitely have seen an increased awareness and people being more willing and definitely wanting to take supplements to improve their health and their immunity.
And she's brought several pharmacists on board through seeing the results that you've had over this past year, so that's been exciting. All right, well, folks, I want to thank our health professionals for coming up here and sharing why they chose NeoLife. Let's give them a huge round of applause. Thank you all so much.